My name is Professor Gourdas Choudari. I am at the moment Professor and Head of Department of Gastroenterology and Hepatobiliary Sciences at Fortis Memorial Research Institute, Gurgaon. Earlier on, I was Professor and Head of Gastroenterology at the Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. For the last several years, we have been celebrating World Hepatitis Day, and that's a very special day for all of us, both as doctors and also we try to enthuse the public about it. Hepatitis is actually a disease caused by viruses. There are about 5 viruses, A, B, C, D and E. But the primary focus on World Hepatitis Day is on 2 viruses, Hepatitis B and Hepatitis C. Why they are important is because these 2 viruses have this habit of lodging in the body for a long time, remaining there for months to years, damaging the liver, causing what is known as liver cirrhosis, and if they have been there in the body for a long time, they can also cause liver cancer. The interesting thing is that these 2 viruses are both easy to prevent. These viral infections are easy to prevent, and also there is specific treatment in case somebody gets affected. The tragedy is that not too many people are still aware about it, and that's the reason why problems occur. So to start with hepatitis B, if 100 people get themselves screened or tested, about 4 of them, that's 4%, will be positive for hepatitis B. All of them may not have a problem, but some of them might actually have the live virus, which might go on nibbling at the liver and then causing liver damage and liver cancer. So much of the time that this person spends with his infection, he may not have any symptoms. But if you detect this infection on time, then you can actually offer him good treatment so that his liver does not fail. So this is done by a very simple test. It's a blood test. You have to just take a drop of blood and then find out whether or not you have the infection. So remember that 4 out of 100 may have this infection, but 96 would not have this infection. Now for those 96 who don't have it, it's a very important opportunity to look for a preventive strategy. And hepatitis B is best prevented by vaccination. You have to take 3 doses of the vaccine at 0, that's today, then 1 month later, and then 6 months later. So 3 doses complete the vaccination schedule. It's one of the safest vaccines available today in the world. And with the 3 doses, you have a more than 95% chance of protecting yourself from hepatitis B for the rest of your life. So the potential benefit is immense if you get yourself tested for hepatitis B and then take the preventive strategy for hepatitis B. By chance, if you are within the 4% who are positive, nothing to worry. Today there are at least 6 medicines in the market. They're pretty good. Unfortunately, they have to be taken for a little longish period of time, but they can certainly prevent further deterioration of your liver. Now, how does hepatitis B spread? It actually spreads through infected needles and syringes. So in case if a medical practitioner is using a non-disposable needle or syringe, be careful. If you are going to a barber's place, make sure that the blade is a new one. If you are undergoing tattooing, make sure that the needle is a new one. It can spread through unprotected sex. And one of the other commonest methods of spread in the community is that often a mother doesn't know that she is carrying the infection and spreads it unknowingly to her newborn child. So if these people get to be a little aware, then prevention of hepatitis B is pretty easy. For instance, today in India, they have recommended that all mothers who are pregnant should undergo a test for hepatitis B. And if she is positive, then it's very easy to prevent the child from contracting the infection, because you need to give the first dose of a vaccine and HB immune globulin within 12 hours of birth of that child. So that in fact would confer a lot of protection. So there are methods around as long as we know what to do, and for that there has to be a lot of increased awareness about these diseases. Now I'll just turn my attention to hepatitis C. It's yet another virus like B which is spread through the same methods that I told you. Infected blood, infected needles and syringes, tattooing, dental extraction with instruments which have not been sterilized, and so on and so forth. The methods of prevention are almost similar as that of B, except for one difference, that hepatitis C doesn't have a vaccine as of now. So much of the emphasis on prevention has to be done with preventing the other steps, like say for example getting blood which is properly screened, using disposable needles and syringes, and so on and so forth. If by chance somebody has hepatitis C, again it's a curable disease. The problem is that the treatment has to be a little long, it's a little expensive, but again it's a disease which can be cured with about 6 months of therapy. So it's important to know if you have had hepatitis C, especially for people who have had surgeries in the past or who have had blood transfusions in the past, or if suppose on a routine regular checkup you find that your liver enzymes are grossly abnormal. So these are the things that I would want you to know so that you can protect yourself and your loved ones on World Hepatitis Day. Thank you.